Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist in the state of Minnesota, and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow with a vision to find sustainable solutions. We hope to share our stories of wins, losses, resilience, and inspire and empower our community because we fly higher and longer when we fly together. Before we dive in, a disclaimer. The views shared on this podcast are an individual's and in no way are contributions from any institution, organization, or guidelines. For our session today, we have Dr. Debra Patt, who is a practicing oncologist and breast cancer specialist in Austin, Texas. She is the Executive Vice President of Texas Oncology and is the Medical Director for Public Policy for the U.S. Oncology Network. She serves on the ASCO Board and is a passionate advocate and is the elected President of Community Oncology Alliance. As recent as last week, she was testifying before the U.S. House of Representatives on biosimilars and how we can make this a more amenable entity for our patients. On her personal time, Debra loves to walk her dogs every morning. Dr. Patt, welcome and thank you for being here.
Thank you so much, Jasmine, for having me. It's my pleasure.
Wonderful. Tell us about the U.S. Oncology Network and Texas Oncology, and what should our audience know about those?
Sure. So Texas Oncology is a physician-owned independent private practice in the great state of Texas. We are a very large private practice. We have about just over 300 sites of service all throughout the state. We're a multi-specialty practice, so medical oncology, radiation oncology, gynecologic oncology, minimally invasive thoracic surgery, breast surgery, colorectal surgery, urology, some neuro-oncologists in the mix. So multi-specialty. We have about 900 clinicians in the practice at our 300 sites of service. And Texas Oncology as a private practice is part of the clinically integrated network of the U.S. Oncology Network. And so that's a clinically integrated network that serves to support our practice. And so that's really a relationship that we have, a business relationship that we have with these other practices for the purposes of sharing things like a strategy around clinical trial accrual, so we can have clinical trials at our site of service, so we can grow as a practice because it's a business relationship, and so they help us with business planning when we have to do things like build a new cancer center. They help us to build a new cancer center with a lower cost of capital than we would have as an individual private practice acting alone. And so the U.S. Oncology Network is a clinically integrated network that spans over 29 practices across the country and sort of brings these efficiencies to independent private oncology practices.
So would you say, Debra, that this is kind of like a midpoint between like a large healthcare system versus an individual who is owning a private practice, because you guys are large enough that you have all the multi-specialty, physicians in your practice?
It's a good analogy, but it's different. And here's why it's different. As a physician, and as a physician-owned independent practice, we sort of operate quite differently than do major hospital systems. We're reimbursed on a different schedule. So they're generally reimbursed. Clinics that are associated with big hospital systems are reimbursed on the HOPS schedule. We're reimbursed on the physician fee schedule. So the natural consequence of that is we are on average about half the cost in a physician private practice. But what we've seen emerge over time, because there's been so much consolidation and movement towards hospital systems, that many private practices have found it difficult to stay open. And many private practices have chosen to align with clinically integrated networks to offer some of these efficiencies in business stability to help them be stable and grow.
That's very exciting to hear for someone who is looking to get into private practice but exactly doesn't know where to start. So what would be one or two like guiding points to a fellow or trainee who's like, I want to do private practice, but at the same time, I'm very scared to dive into this field because private practices are very hard to survive or sustain?
Yeah, it's a great question, Jasmine. And I would say I don't think probably many trainees think about, I want to join a private practice, because we all train in academic institutions. We all sort of train in the ivory tower. And so, so it's hard for us to become familiar with that if you don't do rotations in private practice. But I would say that I love being in a private practice. I've been in practice in Austin, Texas, part of Texas Oncology, for 19 years now. I feel like a pillar of my community as a cancer expert in my community. I feel very much integrated with the community, and I feel like I get to spend the majority of my time between being a doctor and then being a business owner and really thinking about how we drive change. And it's been my experience for many of the digital healthcare solutions that I've implemented that I feel like we've had a little bit of an easier time championing change than I've seen at some larger healthcare systems, because we're a physician-owned private practice.
Wonderful takeaways. And so pivoting to the next piece of our questions here, what you've worked on ASCO's Artificial Intelligence Task Force. Tell us about that, and tell us, how can AI help mitigate burnout or impact shortages, workforce shortages?
These are great questions, Jasmine. So I have been leading ASCO's AI task force. I think ASCO, like many professional societies, are trying to understand how we use AI to serve our constituency, being the ASCO members. I think that we're trying to understand how to make sure that people use it responsibly. And so some of the early work in the task force was to get everyone sort of up to speed in what's out there and where we're going. And then we worked together on creating some principles for responsible use of artificial intelligence, which I think are important. So that's been work we've done together. And I will say more broadly that ASCO as an organization is continuing to try to consider how they will use AI to better serve the constituency, to make the tools that they have more accessible, to have tools at doctors' fingertips in a way that's easy and efficient for them to use them, to increase the usability of things. So I think, that's something that the leaders at ASCO continue to work on and will likely be part of their work for some time. More broadly, as you think about how AI serves the oncology workforce in so many ways, I think that AI will be a part of every aspect of care delivery, from how we get reminders to screen patients for cancer, from how we interpret diagnostic studies to determine if cancer might be present, to how we think about drug discovery, how we manage our workforce, how we think about clinical trial eligibility, how we think about altering clinical trials to be more efficient and effective, how we support patients in transitions of care. So really in every aspect. And, in some aspects that people don't really realize, like, for example, in Texas Oncology, in my private practice, we have some leaders that have championed a digital scribe service that's using AI. So now, when I go into a clinic room, I have my ambient AI scribe on my phone, and I click it. When I walk into a patient's room, it listens to our conversation and it aggregates a note. And so I don't spend 2 hours at the end of my clinic day completing my notes on my patients. I spend probably 30 minutes at the end of my day proofing my notes that an AI scribe arranged for me after ambient listening in a room with patients. And so if I could say it differently, I would say that for doctors, and also true for nurses and administrative staff, if you're spending 50% of your time on clinical work, sort of the power between your ears to practice medicine, and 50% of your time on the administrative burden of practice, which is not satisfying really for anyone. I would see this future where we're going to be spending 80% of our time on the clinical work, 10% of our time on the administrative burden, And my hope is 10% of the time, for my partners anyway, as owners of our practice, thinking about how we drive change to continue to make process improvement.
Those are some fascinating insights, and I can't wait to see the new ASCO survey 5 years down the road where AI is helping reduce burnout amongst us. That's great to know. The ASCO's report on state of professional well-being, Debra, reports that we have like half the respondents, reporting burnout because of staffing shortages or EMR-related issues. How do you envision that AI is going to impact EHR related issues? I think one of the things you mentioned that it helps scribe the notes, but are there any other areas where AI is helping reducing EHR related issues?
So many ways. So I think scribing is a really important one.
Mm-hmm.
I think management of prior authorization is something that is a great opportunity because that's really challenging for doctors when we continually get denials for evidence-based therapy we know is absolutely indicated.
Mm-hmm.
But there are also other ways, like it's hard for clinicians, for doctors to manage their time in clinic whenever there are staffing shortages like nursing shortages, dosimetry, physicist shortages. And we know all of those are present and will be present for the next decade.
Correct.
So AI systems to support those professionals makes their work more rewarding, allows them to operate at top of license and creates capacity. And I'll just give an example. We have used for the last 6 years an electronic patient-reported outcomes tool. And we have a process for symptom management for nurses that when patients call in, if let's say they have a symptom like nausea or diarrhea or fever, they have some symptom management pathways that they're using to manage those patients. Now we have AI that supports clinical decision support for those nurses to help to bring up the pathway and populate the note for the clinical record and the note for the patient. And you think it's a little change, but by doing that, what you can do is decrease decision fatigue amongst our nurses, allow them to operate at top of license, decrease the administrative burden so they're not having to make a note from scratch, but they can look at a note and then modify it, which is much easier than making a note from scratch. It takes a lot less time. And so, again, if you think of 50% of their job as being a nurse and 50% of their job as being an administrator, if you can shift that so they're able to be a nurse about 80% of the time, then you're building capacity, you're building job satisfaction, you're diminishing decision fatigue, and you're building a more stable workforce for the long run. And that helps everyone because, while doctors know how to start IVs, we don't want to be starting our own IVs for chemotherapy. We need our nurses.
Absolutely.
And so making sure that those important parts of the workforce are stable is really important. So I think AI is part of that solution for every person in the clinic, whether that's a nurse or a doctor or an advanced practice provider or an administrator. I think that there will be aspects of that helps everyone. But it's not enough because I feel like we need help and support to stave off burnout. We are going to face increasing numbers of cancer patients simply because of the age distribution of the population. There's the silver tsunami, as they call it, right? And cancer largely is a disease related to aging. So we can anticipate that people will have more cancers to deal with. So our jobs are going to get harder. Now, doctors, Jasmine, are very resilient people, right? We're resilient. Yeah. We have a lot of ability to get up and get going again and deal with the hard things. And being a cancer specialist, I think it's not telling someone that they have a cancer that causes burnout. It's not even the hardest cases of giving someone the anticipation of how they might support themselves as they go through death. I don't think that causes burnout because this is gratifying work that we do, but it's the prior authorizations, the administrative burden, and all those other things that cause burnout. So I think that we as a professional, as a professional group need to have ways to manage that for our organization. So we've embarked upon a physician wellness campaign that we have a wonderful leader, Vikas Arora, Dr. Arora, who's championing. And we've engaged a solution called Vital Work Life that helps to support our clinicians. It's actually brand new, but already we have doctors that have engaged in some of their assistance mechanisms, everything from concierge support to your life to counseling resources. and other resources that's completely anonymous, because I do think that burnout among physicians is hard. We have workforce-related challenges in our future. And so all organizations need to be thinking about this critical issue of how do you sustain a workforce and stave off burnout and support people. And it's not simply an issue of people might work less or leave practice, though that's true. If people are burned out, they will not work as effectively. They cause burnout in the rest of their team. If they're disgruntled, they don't take as good of care of their patients because they become less passionate or compassionate, but they also are more likely to have things like divorce. They are more likely to have suicide, depression. And so lots of compelling reasons to deal with the important workforce support for oncologists.
That is said brilliantly. And I'm glad that you are talking about AI as a comprehensive utilization tool in every step of the cancer care delivery, and also comprehensively within our workforce, like not just physicians, but also nurses. And I'm glad that you concluded with the physician well-being piece, which is so critical in this day and age. Thank you, Debra. So what would be one or two changes you would like to bring to your private practice if you had the magic wand tomorrow?
Well, I spend a lot of my time. So even though I'm a breast cancer specialist in the clinic, I spend a lot of my time in healthcare policy and digital solutions to support the practice, which right now is a lot of AI, and in sort of the business of medicine. And I sort of stand at those intersections. I think that's the value I provide to my practice. So as I think about things that we need to change in order to continue to evolve, and, be the best place for patients to receive their cancer care, I want us to adopt AI solutions in a meaningful way to support a patient's journey. As I think about that as an organization, I often talk about it as the road to nirvana, nirvana being this, ideal place that we'll never actually get to, and nirvana is changing. But the different digital tools that we use on the path to get there are sort of stops along that journey. And there'll be many, right? Everything from the communication architecture by which we use multi-channel communication with patients, the EPRO platform that we're using to track symptom monitoring in patients, tracking of oral oncolytics in patients, chart summarization tools that use AI, AI for a digital scribe service, how we communicate education to patients through the portal. You can think of those as sort of many stops. So I would like to see us be quick to adopt changes that are going to be meaningful to the practice and have a clear path on this road to nirvana, recognizing that these capabilities are going to continue to improve and change dramatically over time.
Wonderful. Thank you. Debra, what would be one piece of advice you would give to Debra Patt of 10 years ago?
I think always to be solution-oriented and recognize when you foresee problems in your organization, in your clinical practice, that you need to be part of the solution to fix them. Otherwise, it's not entirely a waste of time to complain to someone else to fix it, but to bring solutions to the table as you consider how your practice and growth is limited. Right. Because that's really the best way to engage in having a better practice for tomorrow.
Right. As they say, grass is greener where you water it, right?
Yes.
Okay. A little bit of rapid fire about you. What's your favorite book?
My favorite book is Thinking Fast and Slow, talking about two different systems of how we make decisions. I think it's really important as a cancer specialist, and I think behavioral economics more broadly is really important. But it's really important as a cancer specialist because when patients get their diagnosis with cancer, it's usually the worst day of their life, and they're making complete fear-based decision making. And I feel like as an oncologist, my role at that moment is as an educator, that I need to educate them because knowledge is power and get
Right.
them to the point where they're having logic-based decisions. So I feel
Mm-hmm.
like we have a big gap today in patient education because there's
Mm-hmm.
asymmetry of information between doctors and patients. So
Right.
I love thinking fast and slow because I think it speaks to that. Also, as I use a lot of digital tools and I'm helping us lead a lot of digital tool implementation in my practice and in my network, I think about how we support clinician decisions, because clinicians are very autonomous creatures. We don't want to be told what to do. But if you modify our choice architecture, like a
Right.
nudge, like Cass Sunstein, Richard Thaler wrote a book called Nudge, um, then it really promotes good decision making. And I think that's how AI and many digital tools are going to support clinicians best, really
Mm-hmm.
where it alters choice architecture in the format of a nudge and allows our clinicians to still be at the center of decision making, autonomous decision makers, but with choice architecture to support optimal choices.
Wonderful insights. Thank you. Your favorite leader?
My favorite leader, I'm going to say there's so many, but I'll say Winston Churchill.
Okay.
I find myself quoting Winston Churchill quite a lot, mostly to persevere through adversity, and ultimately, have a good outcome.
Absolutely. Your favorite cancer study?
My favorite cancer study is in I think it was 2017,
Mm-hmm.
Ethan Bosch's study, which was presented as an ASCO plenary session on the role of EPROs improving survival in patient and time on therapy in patients with advanced cancer.
Mm-hmm.
Was my favorite study. And I will say I was in the room when it was selected as a plenary because I was on the scientific planning committee.
Mm-hmm.
And if you get to be there for the scientific planning committee, it's like you discuss all the relevant abstracts. It's sort of like seeing the trailers to all your favorite movies. It's such a fun. It's like my favorite day of planning when you get invited to that meeting. And we got to pick it there. But I think it's so meaningful because it was an unusual plenary session. It's an
Uh-huh.
unusual study because
Right.
it's looking at a digital tool really to support symptom management and showing
Right.
how implementation of that digital tool can really help the patients through their journey. So I loved that because, that's part of my passion and how I think we can support care delivery.
Absolutely. And very timely too, right? If it was in 2017, right?
Yes.
Wonderful. Your favorite restaurant in Austin?
I have two favorite restaurants.
Uh-huh.
I like Abba and I like Peacock. Both of them are Middle Eastern food
Mm-hmm.
here in Austin. But Austin has become, in the 20 years I've lived here, quite a foodie town. So
Yeah.
lots of good choices.
Aw, very fun. Okay, one fun fact question about you. How did you meet your husband? Please share that story.
So my husband and I met the day before medical school started over our cadaver,
Mm-hmm.
Doris, who we dissected together for the next 6 months. Yes. So we were both, you come in sort of pre-orientation to get your information and find out your agenda for the next day. And they let you into all the places. And of course, everybody's kind of interested in seeing the gross anatomy lab. So I met my husband over our cadaver. We were medical students together.
Aw, that's sweet. Last question for you, Debra. If you were to relive your life, would you become an oncologist?
Absolutely. I feel like being an oncologist is incredibly gratifying work. I feel like it's such a privilege to be able to see patients through this journey where when you meet them, they're very vulnerable. And if you can do a good job of educating them and showing them a path forward to where they can have as good of an outcome as possible,
Uh-huh.
then, you are able to really make a meaningful impact on their life. And it's an incredible journey. And I'll say that I can't think of anyone that gets the miraculous experiences like oncologists do.
Yeah.
And I'll just give one story. There's a patient who I diagnosed with her second breast cancer at 29. And
Oh.
she's publicly talked about this, and so it's not I speak
Yeah.
about it with her permission. But
Uh-huh.
I diagnosed her second breast cancer at 29, and at the time she was newly married, and I She thought she wouldn't be able to have children because she'd already had one breast cancer and chemotherapy. And I had her do fertility preservation with her husband, and which she did, and treated her second breast cancer. It so happens that after her second breast cancer, I happened to be at a social event for her where she collapsed in front of like 600 people, and she had a cardiac arrest. And my husband and I and colleagues resuscitated her. I literally have pumped her heart with my hands. And after that point, a surrogate carried her child, which she delivered. And this last summer, her 14-year-old daughter now, right, this child.
Oh my God, I'm having goosebumps.
I know, came to Austin. She doesn't live in Austin anymore, but she came to Austin to do a ballet performance. And I got to watch her pirouette across the stage as part of this like special performance with Austin Ballet. And I sat with her mother, the 2-time breast cancer survivor, my former patient who now lives in another state. And her mother is also a breast cancer survivor, as we watched together her daughter. And I thought, these are, women who I've been intimately tied with, like literally pumped her heart with my own hands, like intimately a part of their life story. And I get to see her in this wonderful dream she's had of being a fulfilled parent, come to fruition. Like, who gets to do that? We're so lucky as oncologists how closely we touch people.
Absolutely. That was a wonderful, tremendous, profound story. Thank you for sharing that. That is all, Debra. So thank you for sharing your insights. The 3 key takeaways for the oncology community and our audience from today from Dr. Patt. I think rotations in private practice should be a part of the curriculum. I think that's a really good idea, so that fellows and trainees can really assess for themselves which way do they want to lead their life, right? Because I think their decision-making is biased if we're just exposing them to academia. For AI, Dr. Patt gave me a lot of insights. I'm trying to consolidate them as best as I can. Accessibility and responsibility, I think, are the 2 key words that I think we should latch ourselves onto. It should be comprehensive in its outlook for different steps of our care delivery, starting from screening to survivorship, etc., goals of care discussions, etc., but also comprehensive towards our workforce as well. Like, it's not only physicians who can use AI-based tools to improve burnout, but also our nurses, APPs, administrative staff as well. And then the last key takeaway is be the part of a solution and not problem. Problems they're going to come up. Every day, every field, every different style of practice, there will be different set of problems. But if we can try and strive to be part of the solution, I think that's a really big deal. So thank you so much, Dr. Patt. Thanks to our viewers and listeners. This is Jasmine Kamboj and Debra Patt signing off on behalf of OncoDaily from our conversation today on Empowering Oncologists. Thank you.
Thanks, Jasmine.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.